Good morning and welcome. My name is Gloria McMullen and I'm your host today for the Emergency Preparedness webinar. Based on recent local headlines relating to recent tornadoes that have touched down in West Michigan, extended power outages during extreme low temperatures, flooding, severe storms, etc., it is important to prepare a plan of action. When working with people with disabilities, it is even more critical that a plan is prepared that is inclusive of the needs of the people we serve. The purpose of today's webinar is to share information about emergency preparedness. This webinar is timely and much needed. Today's webinar is being brought to you by MARO and the Office of Public Health Preparedness, Michigan Department of Community Health, and our presenters are from the Department of OPHP, DCH, and they are Rachel Ruddick, Kathy Wall, and Carrie Chamberlain. And to them I say welcome and thank you for hosting or facilitating today's webinar.
You're welcome. Okay. Good morning. My name is Kathy Wall, and I work at the Office of Public Health Preparedness. I'm the Emergency Management Coordinator for the Michigan Department of Community Health, and we really are glad that you want to hear more about emergency preparedness and ways that you can help your clients with emergency preparedness. Michigan, there are 1.9 million Michiganians who have physical, medical, sensory, or cognitive disabilities. And so emergencies such as fires, floods, and acts of terrorism present a real challenge. Although in Michigan, we don't have a lot of huge emergencies like some states like California or Florida. We don't have the hurricanes and the huge numbers of wildfires, but we do have our own challenges in Michigan. And if you compound that with vulnerable clients, the outcomes are also not so good. So the MDCH mission here is to protect and preserve and promote the health and safety of the people of Michigan with particular attention to providing for vulnerable and underserved population needs. And that's why we're doing this webinar today, because that's really your mission for the organizations that work with MARO. In our office, we do some capabilities-based planning for emergency preparedness. I'm not going to go over all of the capabilities because it gets rather cumbersome and boring, but really what we want to address through talking to you today are community preparedness and community recovery, sharing of information, and emergency public information and warning systems. And why are we talking about this? Well, I've already said that we have 1.9 million Michiganians that have disabilities. And people with disabilities in any disaster, as we learned in Hurricane Katrina, are more likely to have negative outcomes. Can I go back?
Yep. No, you're right.
Oh, right, on the left. Sorry, I held my finger down too long. I've mentioned vulnerable populations, and most of us that are in healthcare or in service industry don't like the term vulnerable, and people with disabilities probably wouldn't like the term vulnerable because it makes them seem like they can't take care of themselves, when in all reality, everyone has a personal responsibility before, during, and after a disaster to be able to care for themselves. And we have to look out for individuals with disabilities and try to make it so that everything is accessible to them. We at OPHP, when we started looking at vulnerable populations, we looked at definitions of vulnerable populations, and I'll go a little bit more into that in a few minutes and tell you what we came up with. But ultimately, we're referring to persons who are at higher risk of negative outcomes in a disaster when we talk about vulnerable populations in emergency preparedness. Well, I'm back on the wrong side. I'm sorry. I'm used to the whole thing. One of the things that we talked about when we were preparing this presentation and adapting it was something about empowering ourselves and Carrie's going to talk a little bit about it later on, but and I'm going to say it now, and so maybe by the time you hear it the second time, it will instill a little bit in you, some planned redundancy. But it talks about being your own hero, and in order to be your own hero, you have to empower yourself and empower survivors of emergencies and disasters. And one of the analogies that we came across, I don't know, it was probably a couple of weeks ago, was would someone rather be during a power outage or an emergency, be sitting in their own home eating a peanut butter and jelly sandwich, or be stuck in a shelter where they're eating, peanut butter and crackers and meals ready to eat, the MREs that are distributed? And, I would think a lot of people, it's my own personal opinion, but would rather be sitting at home eating their own peanut butter and jelly sandwich and knowing where things are and being in their own environment. So hopefully today will help you empower yourselves as well as empower your clients. And this is the whole, now I know this is a busy slide, but it's what we struggled with here when we talked about vulnerable. And there's a few different frameworks out there, and I'm not going to spend a lot of time, but essentially what this depicts here is that any individual in the middle, this is the CDC definition of vulnerable populations or special populations or at-risk populations, which is what we finally decided on, at-risk. Anybody who has an economic disadvantage may have difficulty with maintaining their health or independence or being safe or finding transportation. People who are elderly or too young have difficulties maybe with these. If they have a language and literacy barrier, they may not be English speakers as their first language, and they may have trouble with maintaining health or communicating. So really when we look at the outer ring, which is what FEMA describes as, they describe it as functional needs. CDC describes the center as at risk, and really we're all talking about the same thing. So no matter what term you hear, we're all talking about individuals who may be at greater risk of having a negative outcome in a disaster or emergency situation. And I like this quote because that's what we're doing today. We're talking about fixing the roof when the sun is shining. We're talking about getting our plans in place for ourselves and our families as well as for your clients. So it just makes good sense to prepare ahead of time. When you prepare ahead of time, there are some advantages. You have a little more peace of mind. You know that when the tornado warning comes, you're going to go in your basement and you're going to have all the things there that you need to survive if the worst should happen. You're going to empower yourself. You're going to be your own hero. And ultimately, you have a better chance of getting back to the way things were before the disaster struck you. So you'll be more resilient. And resilience is a big buzzword in emergency preparedness right now, and it's really what it's all about. It's all about survival and returning to normal. So where do you begin? When you talk about emergency preparedness, it can be huge and it can be daunting. So we tell people to just stop, take a few moments, and I think that this quote really describes that well. First, you think about it, then you organize your thoughts and your plans, and then you implement those plans. You transform them into reality. So the idea of emergency planning for yourselves and the people that you serve can seem daunting, but if you break it down, it does become a little bit easier, and you improve your chances for survival and having better outcomes. No plan is perfect, but any plan is better than no plan. So starting somewhere is where we want you to be. And hopefully today you're going to start thinking more about emergency preparedness and developing plans about first how you can help yourself, then your family, and then the people that you assist or that you work with every day. There are some logical steps toward preparedness. And again, these apply to yourself and your agency as well as to the clients that you serve. And first of all, it helps to know about what community resources are out there. And actually, you are community resources. So who are your partners? Who do you work with? Who do you network with? It's important to know all of the players that are in the game. And beyond knowing that, you need to know what kind of emergencies or hazards that we need to prepare for. It doesn't really make sense to think about evacuation routes a lot in Michigan because we don't have hurricanes. However, if you live in an area that has a nuclear power plant, then they do have some evacuation routes, so it's important to know about. You also need to take a personal assessment. It consists of thinking about what you're able to do right now and what kind of assistance you might need after an emergency. Who are the support people? Now, you might be the support folks for your clients, depending on what your agency services are, but support groups, as we'll talk about later, can also be other agencies. You also need to have an emergency information list and that needs to be readily available, so if something happens and someone comes in to assist you, they know who to contact for you. And that's probably primarily aimed at the clients that you serve, but it could pertain to you individually as well. The next thing that we're going to talk about is a medical information list, because not everybody knows an individual's medical history. Many of us have medical problems that we can't see, maybe hypertension or gastrointestinal problems. I mean, there's a whole veritable list, diabetes. So it's important for rescue workers and individuals who are lined up to assist you to know medical information. And that can just be in a list, but it should be kept somewhere where people can access that. 7-day supply of medications, and I know that's a tough one because not all insurances allow people to have an emergency stash of meds on hand, and not everyone can afford it. That's something that people should talk to their physicians about, especially if they're an at-risk population. Maybe they're diabetic or like my blood pressure medication, you're not supposed to skip every day because you have a bad rebound effect. So it's important to talk about those things with physicians, and you can just mention this to your clients when you talk to them about emergency planning. Knowing your environment, knowing what the exits are and the egress and ingress, ways to get in and out of places that people are in is also hugely important. Having an emergency supply kit doesn't have to be fancy. It can be a paper bag, it can be a plastic garbage bag, it can be a duffel bag, but having an emergency supply kit that we'll expound on in a little while also makes really good sense when you are working on preparedness. Making your environment safer, avoid blocking the exits, avoid blocking windows or painting windows shut so if there's an emergency they can't get out their window. Just trying to make our environment safer for all hazards, regardless, whether it's a fire or a storm, it makes good sense. And then having your immunizations and your vaccines up to date. We can't talk public health and we can't talk emergency preparedness and all hazards planning if we don't mention having your immunizations and vaccines up to date. And for that, we're primarily talking in the adult population anyway about tetanus vaccines and your annual flu vaccines. Truly, truly important. And the other thing that for adults now is it's called Tdap. So when you get a tetanus shot, they include pertussis because pertussis, which is whooping cough, is making a comeback because a lot of people, the pertussis that we had when we were children, it has worn off. So we need to get at least one adult dose of pertussis in. So I just wanted to bring that up. We need to do a hazard analysis. Oh, I need to go back. And when we do hazard analysis in Michigan, we think about all the bad things that could happen. Storms and tornadoes are high risk for us. Floods, extreme weather conditions, heat waves, the extreme cold that we saw last winter, fires, power outages, disease outbreaks, and we do have three nuclear power plants in Michigan, and they're in the lower southeast corner of Michigan and the southwest part of Michigan. And we do not have the one up in Petoskey anymore. It's been decommissioned. The polar vortex of 2014 was something that I think really brought home to us the importance of being prepared. Who would have thought that our winter could last so long and that we would have so many consequences to having all the snow and ice? And that's one thing that we also have to think about when we're doing our plans. You might be prepared for cold because by having some extra mittens in your car, but when you really think about it, one disaster can oftentimes lead to another. So, for instance, in our polar vortex that we had, we ended up with having huge power outages because of the ice that brought down limbs, that disconnected power lines, and then you have people that are cold in their home, they can't heat their homes, they're using generators, and then we're having increased visits to the emergency departments for carbon monoxide because people are using generators incorrectly. So one thing often leads to another. Frozen pipes, no water, all kinds of bad things can happen. So it's not enough to just think, oh, we have bad weather. You have to think about what the other consequences of the weather are. Again, electrical outages, and I have a really tricky mouse here, I'm so sorry. Electrical outages don't have a season. You know, can happen in the winter, can happen in the summer. So if you have an electrical outage and you have a refrigerator and you have to store your insulin in that refrigerator, or you have to store some formula for a baby in the refrigerator, how are you going to address those needs if there is an electrical outage in the summer? And the same thing in the winter. A little bit easier for refrigeration in the winter. Set stuff outside maybe. But you have to really plan for what the other additional issues are going to be. No air conditioning in the summer can lead to heat stroke and heat exhaustion, dehydration, people not washing their hands because they don't have water, and then they get other infections. So lots of consequences to think about. And some of your assistive technology may be dependent on electricity. So if you can't charge the battery for the wheelchair or the ventilator, that someone may be on the home ventilator, or you can't make your oxygen concentrator work because there's no electricity. Those are all things that people need to think through if they have medical devices. The summer of 2012 brought us the West Nile virus, and so that was another thing that happens in the heat in the summer. And this year we have a lot of mosquitoes from the moisture. But in 2012, West Nile virus was responsible for 202 illnesses, and 17 people died from West Nile virus. So getting the word out about fight the bite, use your mosquito repellent, and try to avoid going out at dusk and dawn. Those kind of messages are really important and something that we can help you with through OPHP with your messaging to your clients. But we'll talk about how we can help you more in a bit. We also had spring floods this year, and with flooding comes problems with septic systems if your clients live in the country. It can also lead to tons of other illnesses if people get exposed to flood water. So if someone lives in a floodplain, they need to have a plan. How am I going to get out of this if there is a flood? Who am I going to call? Does my emergency manager in the county, and this goes for all of them, know that I'm here? And that's one thing that we're struggling with at the state is having people who may have additional needs in a disaster getting to know their emergency manager. A lot of people don't trust government, or they might not trust the, giving out the information that makes them feel maybe more vulnerable. But it's important so that rescue efforts can be targeted to those who need to be rescued quickly. And then, of course, we have disease outbreaks. And I like this quote because it really describes our world today when you can fly anywhere in 24 hours, and so a virus is anywhere is really just a plane ride away. And when Dr. Frieden had that quote, he was really thinking about some of the coughs and the airborne kind of diseases like the H7N9 and MERS-CoV, the Middle East Respiratory Syndrome. People are in an enclosed space and close, and truly disease outbreaks are out there, and so having your immunizations and being prepared ahead of time, your flu shots, can help eliminate that. So that should be part of everybody's plan. And I'm going to turn things over to Rachel now.
Okay. Hello, my name is Rachel Ruddick. I'm the Risk Communications Analyst here at OPHP, and so I'm going to start talking a little bit more about personal things that you can do as well as your family, you can do to help your family or to help your clients. One of those things which Kathy already spoke about a little bit, but that's the personal assessment, evaluating what is your level of independence, what help might you need before, during, or after an emergency, any personal needs or resources that would be able to assist you during an emergency, and it's best to consider physical abilities now and what help you would need during an emergency. Plan as if you're having a bad day because of your disability and that you'll need a lot of help. It's always better to over-plan and prepare than to under-plan. And then we're going to go over to look at some personal assessment considerations. Those can be the activities of daily living, any adaptive or personal care equipment that would be needed, any transportation issues, nutritional concerns, electricity or water. Once again, if you need electricity to run any of your medical equipment, or just need electricity in general to be able to provide a source of heat or a source of light, as well as water. If you have water, if you're going to need water for anything in particular. So take that into consideration.
Every person should have about 3 gallons of water per person stored.
Yep. And here's just an example.
One gallon
it's
per
to
day.
help with planning for individuals.
Yeah.
It's a tool to help get you started or your client started with planning. Just quickly jot down what are your abilities today and the help that you may need in an emergency. What type of assistance might you need? Now we're going to talk a little bit about the support group. And it's important to consider who would be available and willing to assist you in an emergency, in essence, creating your own support group. Write these people down, include their names, relationships, and how they would be able to help you. Obviously, discuss this with them, make sure that they're willing and able ahead of time, and share appropriate information from the personal assessment as needed. Choose and practice a way to communicate with each other. If the telephone's not working or if the electricity is out, how are you going to be able to get in touch with these people? Perhaps give them a set of keys if you trust them and want them to have that. And make sure that they know where you keep your emergency supplies. And let the support group know if you're going to be out of town. Provide them with any contact information that you might have if it's possible.
The keys are a huge thing too, Rachel. I had a friend who was allergic to bees, and so that was a hazard. And she went in her house when she got stung by a bunch of bees and automatically locked the door, and no one had a key. She ultimately ended up dying because the emergency workers couldn't get in. So making sure that someone is there that can get in to help you is critical.
Absolutely. So once again, some considerations that you're going to want to, take into place or think about. Make sure that your support group are able to help you. Are they strong enough? Can they communicate clearly? Can they guide you to safety? Are they willing? That's the key. Are they willing and able to assist you? And are you able to share any appropriate documents with them? Moving on to an emergency information list. It is important to have this list made, to have phone contact information, should include home phone numbers, cell phone numbers, work numbers, addresses, and relationships. In a little bit, Carrie will discuss some tools available on the Michigan Prepares website that will be able to help assist in creating this list. But obviously this is very basic, but doctors, fire, police, utilities, any important information that you might, numbers and information you might need in the event of an emergency. Medical information is extremely important to have. It's important to have it written down. It's important for other people to know it or have access to it. So this just displays some of the important information to have. So physician contact information, very helpful for continuity of medical care, as are any specialists. If you see a cardiologist or see, you know, a hematologist, whomever it may be, if it's a specialist and you see them regularly for a medical condition, it's important to have that information included and their contact information down. Hospital affiliations, helpful for obtaining previous medical records if a person cannot be taken to their usual or closest hospital. Hospitals and care providers always appreciate knowing what type of health insurance an individual has. Blood type is not as important because if a person needs blood, they're going to be typed and cross-matched anyway. But then obviously looking at the medications and dosages, it's pretty self-explanatory. That's a very important thing to have. If you are on any medications, your clients are on any medications, you're going to need to let medical professionals know that right away. Continuing on with the medical information, any specific medical conditions, physical limitations, adaptive equipment, communication difficulties, cognitive difficulties, or any mental health conditions, or any other information that you think might be able to assist anyone that is trying to provide you with medical care.
One of the keys on that slide, too, though, Rachel, I want to point out is the vendor's phone number.
Right.
Because if you have problems with your oxygen supply or your oxygen concentration or even your wheelchair, it's important to know who you call so that you can get the right kind of batteries or the right kind of support that you need for whatever your equipment is. And there are a lot of vendors out there, so thinking about who you get your stuff from ahead of time and having that written down is a really good idea.
And how to contact them in an emergency. Here's just another example. This is just a different way to capture the information listed on the previous slide, but this is grouped around the diagnosis. So if you have a particular diagnosis, that's how the information is collected. It's just another example, another way to get the information. I mean, once again, there's no right or wrong way to collect all this information or to organize it or write it out, but it's just important that you do have this information. Additional considerations, do you have a daily plan of care? Is there any medical equipment instructions? If you know someone, if you have a wheelchair or something like that, and someone's trying to assist you, do you have any instructions on how they can assist you or how they can operate any of the machinery? Any recipes for special formulas, catheterization schedules, allergy information, food allergies along with medication allergies, and if you've had any surgeries or any medical care, medical assistance.
And food allergies are just as important as medication allergies. You can, a person can die from a food allergy.
Absolutely.
In a shelter just as easy as they could die from a medication allergy.
Do you have your pharmacist's phone number? Know who your pharmacist is? If you have a case manager, what is their contact information? If over 18, legal documentation of continuing tutorship and a biographical sketch. Pharmacy information obviously is helpful for getting emergency prescription refills if any medication is lost. Case managers, names and contact information is helpful for if there's any Medicare or Medicaid waivers. If a person is over 18, but if someone else is responsible to make medical decisions, it's important to include legal documentation stating that. And a unique thing that may be very beneficial if the person has to go to another residence or shelter is the biographical sketch that includes likes, dislikes, hobbies, interests, and triggers or things that the person will find disturbing. Obviously, if this is a shelter environment, there's going to be lots of people from all walks of life from the entire community that are going to be put in one area. And so it is important to know if there are any special considerations that need to be taken into account. Some pre-planning lessons learned. It's important to keep a 1-month supply of required supplies in the emergency kit, keep a document of daily needs and any medical history in print and in electronic format. This is based on one family's experience during an evacuation from a hurricane. and what they learned off of this was that having more than 1 week's supply of medical supplies was helpful as they were displaced for an extended period of time. Obviously, in some disasters, it's ideal if you're only away from home for a short period of time, but the hurricanes, the earthquakes, fires, things like that, you can be displaced for months, if not sometimes years. And this family also found that having medical information in hard copy as well as electronic was valuable, so having it in both places, multiple locations. Medications, like Kathy said, it's ideal to have at least 7 days worth of medications on hand. We know this can be difficult. There can be some barriers to that depending on insurance, physicians, cost, things along those lines, but it is still worth discussing with a pharmacist and a physician how to be able to obtain at least a 7-day supply if possible.
There are some safeguards in place during a disaster. If a person can't get their medication, they don't have their prescription, there are some safeguards with pharmacies, but truly it's really critical.
Now we're going to get into knowing your environment. A lot of these are kind of basic things, but it's surprising how a lot of people don't necessarily know this information. So do you have at least one smoke alarm on each floor of your home, and make sure that it's working and test it regularly? Do you know the location of your utility shutoff valves and how to turn off the water, turn off the gas? Do you know your evacuation routes? And do you have a safe place to go during an emergency? So do you have maybe a neighborhood meeting place where if you had to evacuate your house due to a fire, where your family, could go meet in someone's driveway or wherever it may be? Do you have a out-of-neighborhood meeting place where you could all meet up if you had to just completely get out of the neighborhood? Ways to make the environment safer. You definitely want to have at least enough food and water to last 3 to 5 days for every member of your home, and this also includes your pets. Don't forget about any animals that you might have. You're going to want to check your exit routes, make sure that they're clear, remove any obstacles, have extra batteries or battery chargers for electrical equipment, and extra pair of eyeglasses or visual aids. That's also key. You can't really evacuate very well if you can't see, or trying to find assistance if you aren't able to see. You want extra warm clothing, hand warmer packets, especially here in Michigan and during the winter when you never know what might happen. It's important to do not use a gas stove for heating. That can definitely lead to carbon monoxide issues and fire in your home as well, and burns. Do not use generators inside the house or the garage. This will definitely potentially lead to carbon monoxide issues and visits to the emergency room. And always follow the instructions of emergency management and public health. Whatever directions are given out, always make sure that you are following those, and always make sure that your neighbors and family members are following them as well.
Having some extra batteries on hand for the radios.
Right. So here's just some basic items to include in an emergency supply kit. You can get as basic, or some people get very elaborate. And the important thing to point out is that a lot of items in an emergency supply kit, they don't have to cost a lot of money. A lot of the items are available at a dollar store, or it might be things that you already have around your house. You just need to put them together in a kit. So basics are food, water, first aid, tools. You want to plan for at least 72 hours or 3 days of being self-sufficient before any type of assistance would be able to arrive and help you. One kit that contains what you need to stay put. So have a kit that you would use in your home. If you had a shelter in place in your home, have a kit together with those necessary items. And then consider having a second smaller kit called a go kit, go bag. There's lots of terms and variations for it, but have a smaller kit that would be easily accessible, that you could literally just grab it and go if you had to just walk out the door of your house, grab the kit and just walk out. and consider your individual needs for what you might need in that kit. Obviously, if you have pets, you're going to need supplies and equipment for your pets. If you don't have pets, you don't need to worry about that and include that. So just consider your family and your individual needs as to what you want in that kit and what you would need. Kathy touched on the immunizations, but keep an up-to-date on your recommended immunizations. It's good to have immunization records as well to know when you've had these immunizations, and always get an annual flu shot. Don't forget your pets and any service animals that you might have. When thinking about planning, you must think about pets and service animals and issues such as if you have to leave your home and go to a shelter, will the shelter take the animal? If your animal is truly a service animal, then yes. If your animal is just a family pet and not classified as a service animal, then you may need to find out from the Red Cross or your local emergency manager if there's a shelter that also has a location for pets. Because we run into this every time there's a major hurricane or a major disaster in the country, people refusing to evacuate because they won't leave their pets behind, and a lot of shelters will not accept pets. So it's very important ahead of time to have a plan for your pet and to know where you can and cannot take them. Okay, so I know this is a lot of information to go over fairly quickly, and you're probably thinking, do they really expect me to remember all of this, or to make sure that every person I encounter in my daily work is prepared for an emergency? And the answer is absolutely not. We know that this is a lot of information, a lot to take in all at once, but we are not going to reinvent the wheel on anything. There are lots of aids out there to help everyone get started. It's best to just start with small steps. Start out with your own plan, so focus on yourself. If you are able to take care of yourself and then able to take care of your family, then you will be able to take care of your clients and be able to take care of your employees and coworkers and the people that you work with. Always, as obvious, help others as much as possible. Emergency preparedness is a big job. It becomes even more complex for people with disabilities. There are many tools and resources available to assist you with your own personal preparedness plans and to share with your clients. Start small, begin by thinking about emergencies, and then begin planning from there. And once you understand how to keep yourself and your family safe in an all-hazards environment, you will have a better understanding of what goes into developing a sound emergency plan. In your position, you're not responsible for developing plans for others, but you are in a good position, and you are encouraged to start conversations about preparedness with your clients and to share any resources you have with them. And emergency preparedness is a part of the mission of the Michigan Department of Community Health to protect, preserve, and promote the health and safety of people of Michigan, with particular attention to and providing for the needs of vulnerable and underserved populations. And then this is just a nice quote about helping others from Mother Teresa. And never worry about the numbers. Always start with helping one person at a time, and always start with the person nearest to you. So start with yourself, start with your family, and then increase your circle from there on who you're working with and who you're able to assist in an emergency. So now we're going to turn this over to Carrie, and she's going to discuss the resources and tools that are available to help you start planning.
Okay. My name is Carrie Chamberlain. I'm the Outreach, Evaluation, and Exercise Liaison here at the Office of Public Health Preparedness. I know that's a very long title, but I kind of do all kinds of stuff here, but my main job is communications, and I also run the MyTrain learning management system. So part of, and Kathy mentioned this earlier about being your own hero, is knowing what resources and tools are available to you for emergency purposes or pre-emergency. A lot of these things are good to look at ahead of time so that if an emergency was to occur, you know where this information is and you can use it. And the first resource that is shown here is something called our Z card. And the Z card, as you can see in the second picture, is a card that folds into a Z. Now, Rachel had mentioned about having electronic and non-electronic means of storing your information. This is actually a good low-tech option. And one of the reasons why we developed the Z card is so people could actually have a little card that talks about hazards on one side, and on the other side you could fill in some information and put it in a wallet, in a purse, in a go kit, anywhere. So that even though we love our phones, I love my phone, and it's a great resource. Having stuff in a low-tech option available to you is very nice, and it's something that we can make sure that if you guys, I don't know if we've already sent some out, but if we haven't, it's something that we can provide. We also have our public website, which is michigan.gov/Michigan Prepares, and this website has a lot of information that we've put together for the public, including information on hazards, which is under the Be Informed, information on connecting with emergency management and public health, as well as how to recover from emergencies, and the preparedness topics A to Z, because we want to make sure that there's a lot of stuff available to you to use. So we put this website together and we update it frequently, and it's a great resource to share with yourself, your family, and your clients. And if you actually go into the A to Z list, so it's actually clicking the preparedness topics A to Z, and at the top of the A category is actually accessible emergency information. So if you click that, that will take you to accessible information. So it's not only just because we understand that a website is good for some and not for everybody, but we need to have other options for those who have any type of disability, including low vision, low hearing, physical, mental, reading, anything. So we do have accessible options and resources that are available. So, and one of them, believe it or not, is Twitter. And we have a Twitter account at MI Prepares, so we post a lot of preparedness information, and what's nice about Twitter is you can put out information that's short and sweet and easily digestible, and we love using it here. And I'll give you an example of how Twitter has actually been really helpful. You probably have heard in the news about the Toledo water emergency that occurred, and that's actually been a pretty big deal. And what happened is actually, I didn't hear about it till Saturday, and Saturday was when the first tweet went out from the Ohio Emergency Management Agency, and also went through our Michigan Emergency Management folks here at the state. So I was hearing about this on Saturday, before the news had it, before anybody else had it. So Twitter, a lot of times if you follow the right folks, including us, you can get a lot of emergency alert type of information, especially if you follow local and state emergency management as well as us. So it's a good way of receiving information. And I remember the tweets that came out on Saturday were all like, who to call, what to do if your water was affected, where to get water, all kinds of good information that would take a little while. Let's say your power went out as well. You wouldn't be able to get that information from a website if you couldn't access it. But Twitter is a way we can get stuff out to you. So it's a very good resource, and it's something, if you don't use it already, I highly suggest it. Even if you don't tweet, I think that's the biggest misconception about using Twitter is if you set up an account, you have to tweet. You don't. You can actually set up an account, follow a bunch of accounts, and just receive alerts on what's going on. So really good resource. Another thing, and it was mentioned before, about not feeling like preparing for emergencies is a big deal. Whereas, and I think one of the issues, especially if you have, you're not of means, is, oh my gosh, I can't go buy all this new stuff to make a kit and buy all this extra food and do all these things, when really you can do it in small steps. You don't have to do it all at once, and that's what Do One Thing is. And Do One Thing is a great resource, and it was developed here in Lansing. So this is not something another state did. This is actually something our state did, and it's been recognized nationally. And what it does is simply break things down into a monthly to-do. So this month is actually to be involved, and being involved means volunteering, helping others. But each month has something different, so that all you have to do is do the steps for that one thing for that month. And if you follow the whole year, you can get everything you need. So it's a very nice resource, and they also have, and I'll go to the next slide here, there are accessibility resources as well. So it's not just the website in one language in one way. They also have audio fact sheets, Braille fact sheets, multiple languages, large print. I mean, I've been through a lot of these myself to refer others to, and they're very nicely done, and they're great to be able to hand out to your clients or others that you think may need these type of resources. There's also, this is the Partnership for Health and Disability of Michigan, and this is their resource and this is specifically for health and disability in Michigan. So their emergency preparedness resources, of course, do one thing, and also disability preparedness, and they link to the Ready.gov. Ready.gov is our national resource that FEMA runs, and that's another great resource if you need to get information. And then there's the Nobody Left Behind project. Now, this was actually a research project that was funded. It was a 3-year project that was funded by the CDC. And really the point was to gather best resources, best practices to ensure that no one is left behind. Because really in an emergency, when we're trying to get through the emergency, we need to make sure no one, absolutely no one is left behind. So this resource actually is a culmination of the resources that were found during this project. And of course, Ready.gov, cannot talk preparedness without Ready.gov. This is the specific flyer for preparing for emergencies now and information for people with disabilities. But there are all kinds of different resources that you can get, and I believe we can, any group can actually email FEMA or Ready.gov if they want specific information sent to them, and they'll send any flyers, pamphlets, or anything else that you may want for free. So it's nice to know, but this one, like I said, is specifically for people with disabilities. And this is, again, going back to social media, Emergency 2.0 Wiki, it's actually a resource out of Australia, and it's folks, and it actually is a worldwide resource, even though it was started in Australia. A lot of people putting together resources in the form of a wiki. Now, we've all heard of Wikipedia, where you can actually edit encyclopedia entries. This is actually where people get together to share information about emergencies. And one of those resources here are videos for people with disabilities. And this is great because in this video in particular, you're looking at American Sign Language. For those who are deaf, having a video to watch, because not necessarily those who speak American Sign Language may or may not be able to read written text, depending on the person. So having something visual using American Sign Language is very helpful. But I know Emergency 2.0 Wiki has lots and lots of information. They also have a Twitter account, and they're a good one to follow as well. Again, going back to Twitter, making accessible tweets. If you guys decide to ever open a Twitter account and actually do some tweeting, there are lots of things that you can do. All this boils down to keep it simple. Keep it very simple. You know, we can, even though Twitter is famous for using kind of bad grammar and shortened words and using acronyms, we may want to not do so many of those, because if it's shortened words that people don't understand or acronyms that people understand, us in government, we're famous for it. We like our acronyms. Remember to spell things out. Even if you have to, let's say you're tweeting, even if you have to, maybe do more than one tweet, because so that everything's explained. You can do it more than one tweet if you need to actually explain everything a little bit better. But still, it's short, sweet, to the point, and any URLs that are put in your tweet, so you can save on space, because you only get 140 characters, spaces, punctuation, and everything included. Shortening those URLs will give you more space to put your message. And of course, if you want to volunteer, and this goes towards anybody. I think volunteering is a big deal, and being able to volunteer in any way you can is great. You could register on my volunteer registry, and what's really nice about this is you can sign up to be a volunteer, but you don't necessarily have to respond to each and every alert you get. So let's say you can't respond to something, don't feel like because you got an alert from the My Volunteer Registry that you are obligated to respond. But you can respond you can actually put in your profile what skills you have. So if you have a specialty skill that might be helpful during an emergency, even if it's just driving a forklift, I mean, there are things.
Or data entry.
Or if you are a caregiver and you have skills working with the autistic or anything that's specialized, that is very helpful in an emergency, because a lot of times we have to query that database and look for specialized skills when people need stuff. So it's put down as much information as you can, and even if you don't have any specialized skills, being a person a body that can help is just as good as having a specialized skill. So anything you can do, mivolunteerregistry.org. And of course your references, I'm not going to go through these, but these are the links that you can use to find more information. Whoops, looks like that one clicked over too fast. So in a final quote, the seeds of great discoveries are constantly floating around us, but they only take root in our minds well prepared to receive them. So think about, because we're not in an emergency right now, think about all these things we've said today. You know, take some time to absorb. We understand that it's a lot of information and there's probably a lot of questions on what to start with and how to do this, but just start, even if you just start thinking about it and try to wrap your brain around what kinds of things you would like to do, it's always a good start. So it's just putting one foot in front of the other and moving in the right direction. So here are our contact information. So if you have questions beyond today's presentation, please let us know.
And we really value what you do every day and the work that you share with others. And if there's anything that we can do to help you, we are more than happy to. We're passionate about emergency preparedness. That's what we do. I mean, we eat, live, and breathe it. But I know it's just a small little piece of what you're trying to do every day. But it's an important piece. And if push comes to shove and we do have an emergency, maybe by being prepared yourself and planting the seeds of preparedness in the minds of people you work with will have a very positive impact. So thank you for joining us today.
Yeah. And if there's any organization that would like any of those Z cards that Carrie was showing at the beginning, feel free to get in touch with any one of the three of us, and we'll be able to ship them out to you free of charge. So I think we have a couple minutes for some questions. Are there any questions?
Oh, good. They've all got their plans started, and they're ready to roll. Did we lose anybody? That's all that we have. Gloria, are you there?
Me all right?
Yep.
Okay. I really appreciate your time today and putting together this presentation for us. I ask that everyone listening out there, please take all this information into consideration. Those we serve may not always be able to return to their home or families in the event of an emergency. So ask yourselves the questions: do we have enough water on site should there be an event like what recently happened in Toledo? Are we aware of the medication schedule for the people we serve? Do we have some type of food on site where if there's a person with who's a diabetic, will have access to some type of food? Are we relying on cell phones? And if we are, do we have some type of system to recharge them should we lose our charge? So just questions to keep in the back of our minds as we prepare our emergency plans. I want to say thank you to Kathy, Carrie, and Rachel again. The information you presented was of great value and will be very useful in developing emergency plans for all of our locations. I really look forward to partnering with you for potential future projects. So again, I say thank you. At this point, I'm going to conclude the recording portion of this session. And if anyone has questions, please send that question to me, and I will present it to our presenters.